Hello, and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician, and today I'll be discussing calcium and dietary supplements for seniors, what you need and what you don't. We are inundated with information on calcium and dietary supplements on TV, the internet, and in magazines, and it can be confusing. The truth is a bit complicated, but I hope to provide some clarity. I won't be talking about vitamins today. Those will be discussed in a separate presentation titled Vitamins for Seniors, What You Need and What You Don't. The information in this presentation is supported by high-quality medical research and expert medical opinion, and references are given at the bottom of many screens. This presentation is for information only. Before you act on anything you learn here, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. Where is this? This is my local Costco, and they have 4 rows of vitamins and supplements that stretch as far as the eye can see. And that's because dietary supplements are popular. More than half of adults take a dietary supplement. In 2021, people in the US spent almost $50 billion on dietary supplements. In 2021, the dietary supplement industry spent about $900 million on advertising. Let's talk about calcium. Calcium is essential. It's needed for functioning of bones, in building bones, along with vitamin D. It's also needed for the function of nerves, muscle, heart, blood vessels, for blood clotting, and for hormone secretion. Most people probably get enough calcium from their diet, from milk, yogurt, and cheese, from canned sardines and salmon with bones. We also get calcium from certain vegetables like kale, broccoli, and bok choy or Chinese cabbage. And some foods have added calcium like fruit juices, soy and almond milk, tofu, and ready-to-eat cereals. Calcium is important, but extra doses of calcium probably does not prevent or benefit cancer, diabetes, high blood pressure, heart disease, prostate cancer, or metabolic syndrome, which is the combination of obesity, high blood pressure, high cholesterol, high triglycerides, and high blood sugar. A big concern for seniors is osteoporosis, which can make us at higher risk for fractures of hips and vertebrae. This image on the left shows normal bone and normal bone matrix. You'll notice that the tan areas are fairly dense. This is bony material that provides strength to the bone. The red areas are where the bone marrow resides. In the image on the right, you'll notice that the tan areas are less dense than in normal bone matrix because this bone has osteoporosis. And ultimately, you'll note that so much bone matrix is lost that very little bone is left and very little strength, and therefore a higher risk of fractures. Calcium can be important with osteoporosis because calcium plus vitamin D supplementation can increase bone density. But it's important to realize that despite increased bone density from calcium, there's no clear evidence that extra calcium actually prevents fractures. So the big calcium question is, should you take a calcium supplement? The research is complicated and confusing, and the answer is very individualized because calcium can have an effect on other systems. So you need to talk with your doctor or your physician assistant or your nurse practitioner about whether calcium would be appropriate for you. Let's now talk about dietary supplements. Let's switch now to talking about dietary supplements. Unlike a vitamin, which is essential for life, a supplement is not essential for life. It's a product taken by mouth that contains a dietary ingredient. The Food and Drug Administration oversees supplements in the United States. The FDA recognizes these items as supplements: vitamin and mineral products, botanical or herbal products like plant materials, algae, macroscopic fungi, or a combination of these. Also amino acid products, which are building blocks of proteins and aids to metabolism, and enzyme supplements, complex proteins that speed up biochemical reactions. The FDA also says federal law does not require dietary supplements to be proven safe to FDA's satisfaction before they're marketed. And they also say for most claims made in the labeling of dietary supplements, the law does not require the manufacturer or seller to prove to FDA's satisfaction that the claim is accurate or truthful before it appears on the product. Furthermore, the FDA says dietary supplements are not intended to treat, diagnose, cure, or alleviate the effects of diseases. And using supplements improperly can be harmful. And also, some supplements can have unwanted effects before, during, and after surgery. So what do experts say about supplements? Well, a group at the Northwestern University Feinberg School of Medicine says rather than focusing money, time, and attention on supplements, it would be better to emphasize regular preventive care, following a healthy diet, getting exercise, maintaining a healthy weight, and avoiding smoking. The U.S. Department of Health and Human Services says nutritional needs should be met primarily from foods and beverages. And the American Heart Association says healthy persons receive adequate nutrients by eating a variety of foods in moderation rather than by taking supplements. The U.S. Preventive Services Task Force says the current evidence is insufficient to assess the balance of benefits and harms of the use of nutrient supplements for the prevention of cardiovascular disease or cancer. And finally, a group of physicians from several medical schools who studied supplements and the research that's been done on supplements came to this conclusion. We believe that the case is closed. Supplementing the diet of well-nourished adults with most mineral or vitamin supplements has no clear benefit and might even be harmful. These should not be used for chronic disease prevention. So the bottom line is that dietary supplements are not the secret to good health. The secrets are healthy diet, exercise, maintaining a healthy weight, not smoking, and limiting alcohol intake. However, some vitamin mineral supplement combinations are therapeutic rather than nutritional for some conditions. For example, for moderate dry macular degeneration, an eye condition that can cause blindness, the combination of vitamin C and E, lutein, zeaxanthin, zinc, and copper, called AREDS2, has been shown to be beneficial for this condition. Also, there's some moderate quality research that suggests some possible benefit from omega-3 fatty acids at a dose of 300 to 400 milligrams of EPA and DHA each per day. There may be some benefit to decreasing the risk of cardiovascular disease. Also, for folic acid at 400 to 1,000 micrograms per day may decrease the risk of stroke. And CoQ10, 200 to 300 milligrams per day, may actually decrease mortality from all causes. But again, before you consider using these, talk this over with your physician assistants, with your nurse practitioner. Now, you may have dietary supplements lying around that you no longer want to take. It's okay to flush these down the toilet or put them in the trash to dispose of them. And they come out in the urine anyway, and many of them are naturally found in the environment in foods as well. But for prescription medications, you should dispose of them differently. Place them in collection containers, and these are available at some pharmacies. Sir William Osler founded Johns Hopkins Hospital and Johns Hopkins Medical School, and is considered the father of modern medicine. He said one of the first duties of the physician is to educate the masses, not to take medicine. Well, I hope I've educated you on calcium and on supplements so that you can make good decisions on whether to take these. And I'll end with the wish that you be healthy. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Best wishes and age well.